Welcome back to Lunchtime News, and many thanks indeed for keeping me company. And I'm not alone now. We are also joined by Dr. Nicholas Anjonjo to shed more light in regards to AI adoption in health. And you bear me witness that when we talk about artificial intelligence, we have seen it even in vehicles, we've seen it even in our homes, our appliances, but now we are crossing over to artificial intelligence in healthcare. Karibu sana daktari.
Asante sana.
Now, when we talk about AI adoption in healthcare, especially here in Kenya, we've seen it maybe in some other parts of the country or other parts of the world. What are we talking about?
Currently, as we speak, there are conversations with regards to policies that will determine how we're going to implement this in our country. So currently, we are having a lot of roundtables, but at the same time, we are having innovators around the country coming together and trying to find innovations that are going to make it accessible to Kenyans as we speak. Yeah.
How effectively do we leverage AI? I know Kenya is one of the tech-savvy countries, and especially in Africa. In the region, I think we are the best. How to improve Kenya's healthcare systems? How do we leverage on AI?
One of the things is, as I said, policies are a really important thing because we can't move forward when our policies are stagnating the movement. So that's one of the things we can try and look into. The other thing is, how can we contextualize these AI models to fit our Kenyan contexts? For example, we are seeing the training data used by some of these big companies in the US and other places are really using the training data for their population. So how can we use our Kenyan data, our African data, to be able to give us a way forward on, or rather contextualize the experience for the Kenyans. So that's something you can look into.
Of course, a big opportunity, especially for the Gen Zs and any tech-savvy person out there. But we are looking at the Kenya doctor-to-patient ratio, which is not conducive. And actually, we have seen even a number of doctors find greener pastures outside. Could AI be used to complement this, or it will also pose a challenge as well?
I can say it's hopeful. There's a lot of hope, especially in the sector, given that, as you said, we have a huge burden. One doctor vis-a-vis the population there's a huge gap, and leveraging this, there's hope. There's hope that we can be able to actually bring in the doctor together with the AI, so that we can be able to complement, we can be able to streamline the care from the point where the patient comes to the hospital, the point where they live. If you're able to reduce that time, I think we can be able to do a good job in that sector.
I noted you are an AI health researcher. Exactly what does that entail? And I'm looking at the challenges also posed by AI. What are some of them?
So it entails, what basically it means is just right now we are in this phase where there's a huge, I can call it an exponential phase of AI. Before, we didn't really know much about it, but right now we are seeing it being implemented in a lot of these technologies. So basically what I do is I try and follow the trend, try and see where we are going with it, and how can we best implement it in our context. For the dangers, there are quite, as of any technology. For example, if we have a place where, for example, if, as I said, we haven't contextualized a lot of the information we're getting from the West. So for example, there's a lot of bias when it comes to the AI that's being used there, because again, it's being trained with their data. So we need to get to a point where we're able to train with our own data, with our own black skin, for example, when it comes to image recognition softwares or AI. So we need to be able to come to a place where we're able to train these models to fit into our Kenyan context, be able to understand the tropical diseases that we are currently facing in Africa and in Kenya.
Yeah. And what about the challenge of data and privacy? AI is not doing a very good job in terms of that. How can we ensure that the medical records, data is kept private?
That's actually a very good question. That's something that a lot of industries are grappling with right now, especially even in Kenya right now. We have these stringent laws on data protection. So that's something you can really look into. For example, finding ways to be able to de-encrypt, de-identify this data of a patient. For example, with the name, we remove the name. We find ways of de-identifying this data as a start, and also just looking into ways that we can be able to secure our servers, whatever data we collect. That's something we really need to look into. And I agree that it's something that poses a great risk.
As a doctor, you have been in the healthcare, I believe, for a couple of years, and we have seen that health is a devolved unit, and we have a lot of challenges, and especially when it comes to SHA. How can SHA leverage on AI to maybe do away with some of the teething problems that we are seeing in the Social Health Authority?
I believe currently they are actually implementing some of those. They have systems which are able to automatically detect certain anomalies in the system. But I believe more can be done to be able to curb the leakages of finances, especially from the system, given that one, it's relatively new. So I believe that they do have some few things have implemented, but they can do much more.
And we've seen also health is devolved, and there is a way that we can also leverage on technologies, on AI technology in counties.
Yes.
But unfortunately, if we look at how the health system here in Kenya works, or how it is, a hospital in Nairobi will not be the same type, will not have the same resources, will not have the same doctors as a hospital in Turkana. And when we talk about leveraging on AI, I'm quite sure we want to leverage on AI in all the 47 counties.
Yeah.
How can counties leverage on this, despite the fact that we have a very big divide between some of the hospitals in some counties and others as well?
Yeah, I believe that if we do sensitization, especially for the doctors, and also the healthcare, basically all the healthcare providers across the country, if we do sensitization and bringing this new technology, again, it's something relatively new, especially for those people. Most of the doctors right now, you'll find some of them are a bit older. So if you're able to do sensitization for them to be able to understand this is something that and it can help reduce the time from the patient, the time it takes for the patient to walk in to the time they walk out. I believe that's something we can be able to, the doctors can be able to, or rather the healthcare providers can be able to bridge that gap. The other thing is governance. Do governors understand this new technology? Because they will be part of the people implementing. I'm happy to see that there are certain governors who are actually in the forefront of leveraging technology for this, and I think it's the future is quite bright.
Doc, what kind of investment does Kenya need? Again, I'm basing my question on the infrastructure that we have, vis-a-vis some of the infrastructure in counties and some in Nairobi and big cities like Nakuru, Eldoret, and Mombasa, vis-a-vis what we have in counties as well.
I believe if we're able to invest, one, in the human resource, being able to talk to people about AI, how do you better use AI to do your day-to-day things, especially for the healthcare workers. That will be one of the steps. The other would be investing in, for example, storage centers across the county so that we can be able to have our data being stored in the country. The other thing is investing in, for example, GPUs. There's heavy investment in the West when it comes to this, the GPUs which actually process the AI. So what are we doing as a country and as counties to be able to increase our, our processing speeds of some of these technologies to be able to implement them at home.
Before I ask you about the future of AI in healthcare, because we have seen the future of AI in phones and it's rapidly growing, you are a doctor in Kenya, so I need to ask you this. In regards to, you saw civil servants have had private insurance covers. Now they were all onboarded in the SHA. Of course, as I said earlier, there are a lot of teething problems. But as a doctor, how do you think maybe we can sort out some of these issues we have?
When it comes to SHA, for example, I was looking at the data. Right now we are having, for example, 3 million people who are actually paying for the services, and vis-a-vis a registration of around 21 million. And so that would mean that the people who are paying for this are much less than the people who are enjoying. So what can we do to be able to increase the number of people who are paying? So that goes by having more people register, have more people pay the premiums, but also the government needs to get to a point where it's able to get the public trust. As you saw when they were rolling out SHA, there was a lot of what can we say, hiccups. So if they're able to, manage some of those things, we can have more people register, pay the premiums. This will reduce the burden, especially on the civil servants, and also, make it work better for Kenyans. Yeah.
We've noted, in as much as AI is developing technology, is a little bit expensive. It's a little bit on the higher side, and we have seen our healthcare system needs a lot of money. How can we ensure that maybe we have partnerships so that we can bring the cost of AI down, that will also cascade to even that remote healthcare center in my village?
That's actually an interesting observation. Let me refer you back to COVID. During COVID, we were able to get subsidies for the vaccines that were coming to Africa. So I believe moving forward, we need to have conversations that we are going to have subsidies when it comes to GPUs. I was looking at the companies which are currently ordering GPUs. They are quite expensive. So how can we be able to...
And for the purposes of our viewers, when you mention GPUs, what exactly are you talking about?
GPUs basically are processing units for some of this AI. They actually run faster than using the CPUs, which are the traditional kind of places where data runs. And so when we have government to government or government to having partners who are able to negotiate and have these things be brought locally so that we can use them locally for our own data.
And the future of AI is limitless and endless. And I would like to pick your mind in regards to AI in healthcare in Kenya. It's a new concept, but we'll get there.
I believe with the current projection, with the current trend that is going on, I believe that there's so much that we can be able to unlock when it comes to AI in healthcare, especially in Kenya.
Final words.
My final words is that this is a new technology. We need to first be able to understand what does it bring to the table, what does it do for us, and also what are its limitations. So when we get to that understanding, we're able to move forward as a country, knowing how we can be able to best leverage this for our advantage.
Doc, many thanks indeed for shedding light in regards to matters healthcare and AI.
Thank you so much.
All the best.
Thank you so much.
I've been speaking to Dr. Nicholas Njonjo. Dr. Njonjo is an AI health researcher.